I think there's a consensus that we need to do something, that healthcare costs are rising dramatically, and that if that we need to do something to minimize the impact of that rise on our economy and to make healthcare accessible to all Americans. I don't really have an agenda here other than just to listen, and it's important to me to understand what people are thinking so that I can reflect those attitudes and insights.
To me, the only thing that we should do, as all the other Western countries have, is that single-payer medical care, and where it's not socialized medicine where the government owns, the hospitals and the doctors. It's where we still can go to our own physicians, and our doctors make the decisions, not the health insurance company.
My concern is that I think once the government starts taking a little bit of what you have, they're going to end up still going to be down the road taking more from you. And I prefer to keep it.
There shouldn't be a disparity between whether you're in Medicaid or whether you're in Medicare, or whether you're in the public option or whether you're in private insurance. There should be equity so that the people don't feel like they have to get into one plan, or the providers don't feel like they have to take patients from one plan and not another. That's the overriding message I got today. In order to get a consensus for a health care plan that works in this country, we have to satisfy a lot of people, and therefore we're not going to get the system that any one person wants necessarily, but as long as there's a general consensus, that I think it'll work.
We started as a volunteer organization. Now we're necessary that people in this community receive the full continuum of care. When patients are diagnosed with a terminal illness, their choices are very, very limited. Most of the time the hospital will tell them there's nothing more we can do for you medically. And within a day their families have to take on the role of being the caregiver for someone who's critically ill and needs good medical intervention. And that's what hospice provides.
President Obama didn't say, here's my plan, I want you to do this. No. What the president said is that we need to do health care reform. Here's some of my general considerations, and I want the People's House to come up with something that has a consensus so that it'll work, so that it'll be acceptable, and so that the Americans will feel like they own it. And he did that, and I think that was a wise thing for him to do.
Well, this is just kind of a nursing and working hub, and then these are the 3 rooms as well.
In San Joaquin County, there really is a community spirit here, and I don't know how else to describe it. When you're a member of this community, we're all sort of in it together. Even the people that are on different parts of the ideological spectrum seem to understand and work together toward a common goal, and I think that's very admirable. I'm happy to be a part of it and happen to be considered a part of the community.